Hello, my name is Dr. Harbpinder Shevchenko from Smiles by the Sea Family Dentistry, and I'm here to talk about today some of the common objections I hear and how we can help you with that. And one of the common objections is that it is too expensive. I totally understand. We totally understand that dental treatments can be expensive and they are expensive at times. And as you know, it's harsh word out there, right? Like things, expenses can pile up on us, but there's financing available. We can help you with understanding your treatment and also helping you out how you can make it work, how you can get your treatment done without feeling that burden, a financial burden. So there's many different financing companies out there today that are very helpful, helping patients getting the treatment that they need so the conditions don't worsen over time. When you come into our office, let us know if that's the case in your case and you need help with financing. We will help you apply for the financing, help you figure out what company will suit your needs, apply to them and help you navigate their system and navigate through all the process so you can get your treatment done. Another common objection I hear is, I'm too old for it. Again, totally understand. We can be all at different ages, but this is the viewpoint we want to look at, or this is the reality that we want to look at, that at any age we want to be healthy. If we are not healthy, that is going to create more problems for us. And now especially we know that how many problems, systemic problems, not only that are related to our heart or our other parts of the body and even to our brain. And doesn't matter, like we are 17 years old or we are 70 years old or 80 years old, as we are living, we want to live to our fullest. And one of the major parts of our body is our brain. So we want our brain health to be fully there for us to be living fully healthy and or be even living. So many systemic conditions, as we just talked about, like brain problems, which is dementia, Alzheimer, Parkinson's, and diabetes, we already know. So many heart conditions we know, they're related to untreated dental problems. And one of the very common dental problem is the periodontal disease, the gum disease, infection in the gums. And I do hear from patients that I'm too old for it. I am 70 or I'm 80. I have a gum problem now. So what? I don't know when I might be not in the world tomorrow. Totally get it. Totally understand. I'm sure hopefully I'll be there one day if I live up to that age. Is that could be the case. But again, what we want to look at is that is putting me at a very high risk of some added health conditions. So you want to treat the problem that is there to avoid other problems to come along the way. So that way you can maintain your health. You can avoid other medications. You can avoid visits to the other doctors. So that is my recommendation, that I totally agree with that okay, I'm older for this treatment, whether it could be a gum problem, whether it's a tooth which is broken down. Ultimately, it leads to infection. If there's a problem, it's not going to go away on its own. As we know, the cavities, the bacteria, the germs in our mouth, they multiply. If there's a little bit now, if it's left alone, it's going to multiply to millions and millions of them. And what they do, they distribute in the whole body. So I recommend wholeheartedly that if you have a problem, please consider fixing it, and fix it when it's smaller. It is only going to help you to stay healthy and avoid other problems. Also, more expenses and more appointment times and going in and out. So overall, it's always beneficial, and it's my recommendation from my heart that please do consider or do take care of it when it's given to you that, okay, there's a problem in the tooth, there's a cavity, or it needs whatever treatment it might be, or there's infection. Jump on it, take care of it, whether you're 17 years old or whether you're 80 or whether you're 70, so that you can keep your other body parts healthy and avoid other problems. Another common objection I hear is that I don't have time. Again, totally understand. We are all very busy, especially when I talk to patients, and I commonly, I say, like, it seems like the time is going even faster every single day, and we don't even know. We have a huge list of things to do, which is all of us. Any patient I ask to, any friends of mine I ask, everybody has a big list that it never ends, right? So totally get it that we are all very, very busy. We have, families and friends and things to do for ourselves. But here's the thing, if there's a problem, first thing is it's not going to go away if the problem is there. It's just going to get worse. So even though we might be very busy, the best thing is to find a time. So that way you dedicate that time, you make that time for it, take care of it. Otherwise, it's just going to get to you. It's going to come to you in a wrong timing. I have seen that so many times that it comes to us, it drops down like a bomb, at a time when it's most inconvenient for us. Like if it's a, very important meeting that you have to go to, is there's a game for a child that you can't miss, it's a birthday or it's an anniversary or it's a wedding. So I highly recommend that even though we are all very busy, very busy in this world now doing many different things, but please make the time, commit to it, just separate that time out that, okay, this time I need for myself so I can avoid further problem or getting into a bigger, expensive, extensive and untimely issue. So that way I just planned, I'm going to take care of it so I can again avoid expense, avoid untimely manner when the problem is going to get to you, and it could be again very expensive and requiring more time. So make the time now, set it up, block in your schedule, plan it out to avoid all that. So I highly recommend that. Another common objection I hear sometimes is that I want to talk to my spouse, or let me talk to my spouse. Totally understand. It's a totally valid communication to say out that I need to talk to my spouse. I would do the same thing as well too, and any other team member in my office would do the same, because when we are living in a household, you have a spouse or you have a partner, you're making decisions together, whether it's financial decisions or some other decisions to go out on a trip, right? So we talk about those things. So similarly, it's a totally valid common question that would you do want to talk to your spouse or your partner, and we completely support that. And there are ways that we can help you with that. So one thing we can do is that you can bring them along with you to your appointment. That way we get to meet them as well too. We love our families together, so it would be great to meet them as well too, to get to know them. And they can help you also make the decision as well too. We can explain them what's going on in your mouth so they know as well too, and they can help you, they can support you, because when we are together, we want to help and support each other. So that takes care of that as well too. And if we can help you in another way, that you want to talk to them over the phone. I am happy to talk to them while you're in the chair, or you want to schedule another time to talk to them, or you want to bring them in back. I'm happy to talk to them. One of my team members can talk to them. We can explain them what is needed, because we have many different ways of speaking and explaining, showing them what is needed so they can understand as well too. And hence, in turn, they can help you get healthy. So I actually completely support that do talk to them, bring them along with you, put them on the phone. We can speak with them and help them understand and help you what you are needing to get healthy. Another common objection I hear is that it doesn't hurt, and so I shouldn't need that. Totally get it. As we know, there are lots of not only dental problems, but a lot of medical problems too. They could be silently going on in our body, and they don't create anything until boom, one day it becomes a big problem. So same thing with dental issues. As we, you might know or not know that, most part of our tooth is underlying in the bone, is covered, and we don't know what's going on inside there. It's covered up with the bone, it's covered up with the gum. We don't know what's going on there. And it's a very important part of the tooth because a nerve lies in that area. So it's related to, there's a blood flowing in there, there are nerves there. If there's something happening to that, it could be silently happening, and one day it can become a big problem. So the whole point when you come into for your regular checkups, or when you're coming in first time, when we are looking in your whole mouth, we are examining everything, we are evaluating your whole mouth, doing your checkup, we are looking at the x-rays, and if we are seeing which shouldn't be there, which is unhealthy, could be part of the gums, could be part of the tooth itself, we are giving you treatment recommendation to take care of that at that point in time. Because as we know, any problem in general, if we can handle that when it's small, it has a better outcome. That's kind of rule of the thumb in general. We know even our household problems. So same kind of holds true for dental problems. It's easier and much faster. It is much less financial burden to take care of the things when they're smaller versus letting them go big, and then you're taking more time out. It becomes more expensive. It becomes more extensive from all point of view. So best thing is that even though if you're not feeling, but the problem is going on, you want to take care of that problem just to help you, so that way you can avoid expensiveness, you can avoid the extensiveness of the treatment and everything all that we don't want you to feel that comes along with it. So take care of it while it's small. When you're actually not feeling it, just handle it at that time. I hope I was able to address some of the common concerns that you have, and if you have any other questions or concerns, please feel free to call us. We will be happy to help you. We are here to help you and get you healthy and keep you healthy. So you can reach us out at 603-926-8827. Give us a call, make an appointment, ask questions. We'll be happy to help you. Or you can also visit our website and get some questions answered there. And also, again, send us a form and we will get back to you and get you back in the office. And our website is www.smilesbythecnh.com. And again, we are here to help you. I do want to help you. Give us a call.